What stood out for me in the discussions in the last 2 days was the emphasis that was being made on us understanding that privatization is a process. And in that process, we need to be clear about who the actors are and what is driving privatization policy. And for partners who are working in the education and the health sector, really the concern is around the impact that privatization has on access to equitable, affordable and quality services in both the education and the health sector. So fundamentally, we should be concerned about whether or not the privatization drive is eroding the rights, the rights to health services, the rights to equitable and affordable education. And the one thing that was said as well was that the actors who are behind the privatization policies are often powerful actors. So there's a lot of interests that are at play here. And civil society needs to be mindful of that, to be mindful that this is a political process. So we will not achieve any changes if the discussions around education are going to be happening in isolation. What we need is to have a very strong movement that has a groundswell. And for us to be able to do that, we have to see ways in which we can bring movements that are working in the health rights sector and in the education rights sector. So I was quite encouraged to see partners who are working at a national level, partners who are working at a regional level, talking about how they can take some of the advocacy agenda forward.